In New York Times political reporter Maggie Astor. Kevin Madden was a presidential campaign advisor for Mitt Romney. And here in studio with me, Dr. Irwin Redlener, co-founder of the Children's Health Fund, senior research scholar at Columbia University, and clinical professor of pediatrics at the Albert Einstein College of Medicine. Welcome to all of you. Maggie, tell us more about this report and the so-called evidence that it's based on.
So this report is was presented as a comprehensive look at children's health and the causes of chronic health conditions among children. And what we found yesterday, I should also say that it was the news organization NOTUS that originally broke this story, so they should get credit for breaking that story. So what we found yesterday was that a number of the citations in this report either were riddled with errors. For example, they listed the wrong author or the wrong title or some such. And some of them were just fabricated altogether. They didn't exist. They had the title of a paper, they listed a journal name, they listed a date, they listed an author, and no such paper existed. So the presence of these fabricated citations in the report obviously raises questions, according to the experts that we talked to, about the credibility of the report's findings. And certainly the researchers whose names were cited in the report attached to papers that they didn't write are very concerned about their names and reputations being used that way, and what it says about the underlying validity of the citations in the report.
So just to be clear, in short, there are entire papers that are cited that never existed. They certainly didn't exist in the journal they said, on the date they said, in the way they said. In addition to that, names of real people, maybe serious people, were used for things that they didn't do. Is that basically the bottom line here?
That's correct. We spoke, and NOTUS spoke as well, to a number of researchers whose names were listed in the bibliography of this report, saying, I'll give an example from our article, Catherine Keyes, a professor of epidemiology at Columbia. She was listed as the author of a paper about mental health and substance use among adolescents. And that paper that was cited in the report didn't exist. She spoke to my colleague, Danny Bloom, who is my co-author on this article, and said she did not write any paper by the title that the report cited, and nor does a paper by that title seem to exist by any author. And that's just one example. There are others.
Such good reporting and important reporting. So, Doctor, you've been working in healthcare, what, 50 years? You have an international reputation in children's health. Press Secretary Caroline Leavitt says these issues with the report, things like formatting, shouldn't invalidate the findings themselves. What did you say? What do you say?
Well, first of all, Chris, let's move away from the technical issues of actually a misinformed, lying document that was put out by the Secretary of HHS. And yeah, they lied about it, they fabricated citations, but at the end of the day, R.F. Kennedy Jr. is using this fabricated information to create policies and recommendations that affect the health of children. Millions and millions of lives will be affected by the nonsense that they put out in that report. It's really unconscionable. It's just really, it's hard to believe. And I do think that people need to focus on what this means. And what it means to me is a reinforcement of what we felt from the beginning when RFK Jr. was originally suggested as a potential nominee for Secretary of HHS. He's unqualified, he's unscientific, and he's promoting crazy ideas that are bad for America's children. And don't forget, he has the biggest public health platform and megaphone of any human being on the planet, Chris. And this is what we have to deal with now. You know, if he was working as an academic researcher at any kind of medical school, for example, and put this out, he would have been fired. And I think the senators who approved this confirmation and the medical organizations that remain silent need to now call for his resignation. He cannot remain in that office using misstated data and really dishonest data to drive critical public health policy that will affect children.
I want to give you a chance to punctuate that because most people don't know the way that this works. You're a doctor in a pediatric office. You have hundreds of patients. To what extent are you relying on this kind of publication and the information that it cites to help guide and update your understanding as a physician of how you should treat and make recommendations to children's families?
Well, of course. And first of all, take the issue of childhood vaccinations, childhood immunizations, which have been proven to be safe, effective, saving lives for decades of children who otherwise in the past would have been dying from diseases like measles and polio and so on. And here we have the head of Health and Human Services saying, well, we're not so sure. We need more information. So that means
Don't come to me for medical advice.
I know we're sitting in our office, and here's a parent saying, well, doctor, should we get our kid vaccinated? And I'm saying, yeah, you should, but what about this report that I just read from the Secretary of HHS? We have to say, no, that was absolutely incorrect. But people are already skeptical about medical information, and this is just exacerbating a terrible situation for practicing pediatricians and, frankly, for families too, Chris.
So, Kevin, you are an expert in communications. The White House defended the report, downplayed these citation issues, and said future questions should go to HHS, which, at least as earlier today, did not respond in any thorough way. Are untruths so baked in that for the voting public it doesn't matter? Or how do you view this?
Yeah, well, I think anytime the White House defers to an agency or a cabinet office, that means they really want no part of it. And I think they do recognize this. The scrutiny here is pretty real. I mean, look, first of all, this was not a report that was in any way routine. Secretary Kennedy and others in the MAHA sort of supportive movement that he's put together have been anticipating this and hyping it for a pretty long time. So the fact that there were these mistakes and these citation issues that undermined it, that's a very big, I think, internal problem that they're going to have. The other part of it is they've always based their advocacy on what they said was evidence-based advocacy. So when the evidence then becomes under this level of scrutiny that they had to expect, given that they were hyping it, I think it really does demonstrate that it's an unforced error. The one thing I think Carolyn Levitt's doing as a communicator here is she believes that the MAHA movement, that is very supportive of Secretary Kennedy, very supportive of the president, is a grassroots movement that is not necessarily going to defer to scientific journal recommendations, but instead they firmly believe that these issues, that somebody's finally speaking about chronic illnesses in a different way than many of the academics or establishment had. And she's trying to speak directly to them. But if you're going to win that debate, you still have to win the larger, big middle of the American public. And they do believe in having conversations and debates that are rooted in some sort of scientific authority.